to Sydney now, and if fighting cancer wasn't hard enough, some patients also end up struggling with opioid addiction brought on by treatment for their pain. Now, a cancer hospital in Sydney has just won an award for its work on tackling this issue. Chris O'Brien Lifehouse has won an Australian Private Hospital Association award for its Opioid Stewardship Program. Michael Soriano is the Director of Pharmacy at Lifehouse, and he joins us now. Michael Soriano, welcome.
Good afternoon, Sarah. Thanks for having me.
Can you tell us something about the scale of opioid addiction in Australia and how big an issue it is, particularly for cancer patients?
We focused on our patients here at Lifehouse. We found that in cancer patients, there's a 20% higher risk of opioid dependency when they're started on opioids compared to just the normal population. That study also found that even after 90 days after starting opioids, 10% of patients are still taking it regardless of their pain. So I think our patients here at Lifehouse are at higher risk of that.
And they're prescribed opioids because of their cancer, is that right?
Usually it's prescribed as part of their post-surgical care. So after surgery, just to help manage pain, that's the main patients that we looked at.
So what are the pitfalls of long-term opioid use? Why are you so keen to bring this down?
The risk of dependency is the main thing. But aside from that, opioids do cause quite a lot of side effects if not used appropriately. So things like excessive drowsiness, constipation, and those things add up in terms of like our patients.
So tell me what you did to bring down the level of opioid use and dependency at Lifehouse.
The model of our Opioid Stewardship Program is really headed by our opioid stewardship pharmacists and working with our pain specialists and also our pain nurse, really trying to involve the patient in decision-making in terms of their care. So instead of patients just being prescribed medications, they're actually being consulted in terms of like what their pain levels are, have they used opioids before, what do they anticipate their pain going to be, and really just having their voice highlighted in that process. And instead of like just giving them a box of pain medications, we actually involve them in that decision.
So I imagine that stopped a number of patients from taking opioids in the first place. Did you also tackle people who had opioids, how to reduce their intake?
We do have a separate program for that, like our outpatient pain clinic usually helps with weaning off opioids for patients who don't need it, especially after surgical care. During the first year of our opioid stewardship program, we even saw a significant decrease, about 87% reduction in our sustained release opioids, drugs that shouldn't be used post-surgery and should be reserved for chronic pain.
So if patients aren't taking opioid for their pain following treatment for cancer, what other techniques are you giving them to cope?
The aim of the stewardship program is not to eliminate opioid use. We just want to make sure that we're only using it when it's appropriate. Aside from that, it's really promoting the other modes of like controlling their pain. So other medications that are not opioids that are a little bit safer to use, maximizing the use of those medications, but also the importance of other measures like meditation, acupuncture that we offer at Lifehouse as well.
That's interesting. Now, people listening might think that's not as good as an opioid, but the funny thing about pain is it's all in the brain, isn't it?
Yeah, like opioids are drugs that mainly act, I guess, in our nervous system or in the brain. A lot of times, like medications are not the only answer to managing pain.
Michael Soriano, thank you for joining us.
Thank you very much.